It will mean lower costs and more choices and coverage you can count on.
Of all of the president's goals for health care reform, he's clearly on track to expand insurance coverage. Where he has claimed the reform will cover most of the nation's uninsured, the fact is that's true. The key bills before Congress actually require that everyone has insurance. In the fine print, however, full coverage for the uninsured doesn't start until 2013, 3.5 years from now.
Our health care costs keep rising.
But here is the hardest goal for the president to reach,
Is to get control of our health care costs,
where he claims that any reform will bring down costs. The fact is, nothing on the table right now leads to savings the administration can prove. Democrats are facing an internal revolt.
It requires us to reduce costs.
Because the Congressional Budget Office said the House proposal would not reduce out-of-control spending.
It raises the amount of activity that is growing at this unsustainable rate.
One big hurdle is this. Mr. Obama and most experts believe costs will go down when doctors are paid differently, not for every single test and procedure, but for healthier patients. But the House bill only calls for a series of pilot programs, including one paying doctors to improve health. In other words, one of the president's most important reforms has to be tested first.
There's not what you'd call a rock-solid commitment to changing the incentives. We will do experiments, but they don't yet say we will move in this direction.
And so tonight, in effect, the president will be arguing we have to spend $1 trillion in order to save long term. He may be right, but he'll need serious changes in both the House and the Senate before he can prove that in advance. Katie?
Wyatt Andrews reporting from Washington tonight. Thank you, Wyatt.